Today, guys, I want to talk about cholesterol. There's so much misinformation out there about cholesterol, and so many people have, quote, high cholesterol. They put a number out there, and the number's changed over the years. What really is a normal cholesterol number? Because if we can know what a normal cholesterol number is, then we know what to shoot for, right? We know when to be concerned when it's outside of that range. We know when we're good when it's inside that range. So as long as your overall cholesterol is, around 200 or lower, then you're okay. As long as your LDL are, under 100, then you're at a low risk for a heart attack or a stroke. And guys, that's what we've been told, that's what we've been taught, that's what we've been brainwashed to think is true. And in reality, none of that's true, guys. And most importantly, there is no normal cholesterol number. My normal cholesterol could be 220. Some other person's cholesterol normal could be 200. There's been studies done by groups of people with a condition called familial hypercholesterolemia, and these are groups of people with cholesterol numbers are well into the 300s, and across the board. And there hasn't been a lot of studies done because the results of these studies have they've gone against, so they've proven all the other research that the American Heart Association wants us to believe. The results of these kind of go against that. And so across the board, these groups of people have better longevity, better mortality rates, less disease, less heart attack and strokes, and yet their cholesterol levels are in the 300s. So I'm kind of confused, right? Because if cholesterol is high and that increases risk of heart attack and stroke, why do these people have a lower rate of all these issues? And so that's the question we need to ask, guys. Listen, we do seminars on this topic, and I talk for a good 45 minutes to an hour because there's a lot to this. I'm just going to kind of give an overview today. So what do you guys think the number one reason for high cholesterol is? Go ahead and put it in the comments because I know most of you guys are going to say bad diet because that's what we're led to believe. Every time you go to the doctor and you have high cholesterol, number one, you're prescribed a statin medication, which we're going to talk about a little bit today. But also they tell you to watch your diet, right? Stop eating all the saturated fats because the saturated fats will increase cholesterol, and high cholesterol increases risk of heart attack and stroke. That's what we're being told. And so most of us are being told that diet is the main thing that you need to think about when it comes to high cholesterol. Guys, the reality of it is diet only influences 10 to 20% of your cholesterol levels. So even if you've got a spectacular diet, you're eating perfectly, you're staying away from your food allergies, you're eating all the healthy fats, none of the bad fats, as long as you're eating well, then you should have nothing to worry about when it comes to your cholesterol. Because we all know that that's not true. We all know those people that have exercised their whole life, they have eaten well their whole life, and yet they still drop dead of a heart attack. A good example is the guy, I forget his name right now, but he was the host of The Biggest Loser, right? This guy was in phenomenal shape. He was ripped, full of muscle. He helped people lose weight. That was his job, right? So he exercised all the time. He ate really, really well. And in his 40s, he had what's called a widowmaker, right? Which is a heart attack that kills most people. Now, he lived to tell his story, and that may be a testament. That may be a testament to his fitness and his health, because he did live through what kills most people. But again, if it's all about diet, it's all about exercise, it's all about eating well, right? Which this guy did all of these. Then why did he have a heart attack? Why did these arteries that are feeding blood to his heart, why did they get completely occluded, and now he dropped dead of a heart, or he didn't drop dead, but he dropped from a heart attack, right? So we got to look more into it, right? Your liver produces most of the cholesterol in your body. And when I tell people that, they're shocked. Like, wow, that's so weird, because my cardiologist, he never talked to me about liver function when he told me I had high cholesterol. When in reality, your liver is responsible for producing 80 to 90% of the cholesterol in your body. So if you have high cholesterol, don't you think it would be a good idea to look at liver function, being that the liver is the organ that produces most of your cholesterol? Of course you would. Now, this is not the number one cause of high cholesterol, right? But we need to always test to see why the cholesterol levels are high. But it is not diet, and that's the reason why I brought this up, because most people think that what goes in your mouth is the main influencer on your cholesterol levels. Guys, we need cholesterol to make every hormone in your body. Who here is stressed? Anybody watching this video stressed? Listen, everybody deals with stress. Everybody has coworkers, deadlines. Everybody's got, in-laws, right? You've got a marriage that you're working on. You've got kids with schedules. You've got budgets you're trying to stick to. I mean, everybody's got stressors in their life. You get stressed out, your stress hormones elevate. Who's heard of the hormone cortisol, right? Everybody's heard of the hormone, yet your doctors are never testing your cortisol levels. And when they do test your cortisol levels, they do a blood draw one time, and it gives you a picture into what your cortisol levels were the moment your blood was drawn. Okay, your cortisol levels change throughout the day. They're supposed to change. That's what what's called your circadian rhythm. All right. So when you get stressed out, your cortisol levels go up. Now, if you need cholesterol in order to manufacture cortisol, what do you think is naturally going to increase if your hormone levels go up? That's exactly right. Your cholesterol is going to go up. The number one cause of high cholesterol today is stress. Because when hormones are needed, your body will naturally increase cholesterol in order to manufacture more hormones. Now, LDL and HDL, right? What the medical community calls good and bad cholesterol. HDL being the good cholesterol, LDL being the bad cholesterol. Now, LDL is a taxi cab, okay? So LDL, low density lipoprotein, is a taxi cab that carries cholesterol from your liver out to the body in order to do its job. Now, I'm not going to talk about everything cholesterol does for you today because I'm mainly focusing on the production of hormones. But guys, cholesterol is a vital nutrient. It does several different things in our body. But just to give you an idea of how important it is, your brain makes up about 5% of your body's weight, yet it's made up of 20% of your body's cholesterol. So you think cholesterol is important for brain health? And the answer is yes, okay? It's absolutely imperative to have good levels of cholesterol in order for your brain and central nervous system to function properly. Not only your brain and central nervous system, but also your peripheral nerves. See, there's a myelin sheath, a conductor on the outside of your nerves that helps the signals transmit over those nerves. You need cholesterol in order for that myelin sheath to stay healthy. That's why one side effect of a statin medication is nerve pain, muscle pain, right? Because it's negatively affecting this myelin sheath, which negatively affects the nerve function and the muscle function, okay? And so LDL is the taxi cab that carries cholesterol from the liver out to the body. So what is their answer when your LDLs go up? What is their answer when your cholesterol levels go up? Because what we're told, again, if LDLs are high, you're at a high risk for a heart attack. And so their answer is to give you a statin medication. So what does this statin medication do? Well, an easy way to put it is it bullies the way your liver functions. So guys, these scientists behind these medications, brilliant. Now, the application, how they're used in the medical world is a nightmare, right? It's devastating to our overall health, but they're very smart. These scientists are brilliant. And so what they do is there's an enzyme in your liver that in the pathway of making cholesterol is blocked by a statin medication. So HMG-CoA reductase inhibitor is what their medications are called. So this is the pathway of making cholesterol. So what they do is this enzyme right here, they block that enzyme so that your liver no longer makes cholesterol, or it makes a lot less cholesterol. Okay, so Lipitor, one of the most popular statin medications, it just inhibits that enzyme. All right, now you can see down here, the same pathway that makes cholesterol also makes what? If you can see it, it's called CoQ10. All right, this is an enzyme that's essential for heart function. And so they're giving you a medication that's supposed to reduce your risk of a heart attack and stroke, but yet it's reducing an enzyme that is essential for heart function. Guys, that just doesn't even sound smart, right? See, this is so important that in Canada, it's a law that if you're prescribed a statin medication, they have to prescribe you CoQ10. Even though it's a supplement, they have to prescribe it by law. but they don't do that here in our country. Do you guys know that in our country, we're the only country in the world that still has pharmaceutical commercials on the TV? Pretty crazy, guys. All right, another big side effect of these statin medications. We talked about hormone production. With cholesterol being forced down through a medication, it's inevitably going to reduce your hormone levels, right? Well, testosterone, especially in men, testosterone is the most protective hormone to the cardiovascular system. Any gentleman that's taking, any female as well, but mostly see it in gentlemen that we test because of things like erectile dysfunction, decreased sex drive, developing man boobs, right? Just becoming more estrogen dominant because this is forcing their testosterone levels down. And so, if we tested any gentleman that's taken a statin medication, their testosterone levels are going to be low. And again, that's just a major side effect of taking a statin medication. And again, we're forcing down a hormone that's the most protective to your heart. We're eliminating an enzyme that's essential for heart health, all to reduce an LDL count, all to reduce an overall cholesterol count. And guys, I'm here to tell you, they even say it in the printouts, they even say it in the pamphlets that come with these drugs. This is out of a Lipitor drug, okay? This is their drug pamphlet. It says right here that Lipitor is not for everyone. Well, that's nice of them to say that. It says, including those with liver disease or possible liver problems, people should not take this medication. So if you have a liver problem, you shouldn't take this drug because it can affect your liver negatively more so. But if your liver's healthy, then it's okay. No, it's not okay, guys. It affects liver function. So long-term effects of taking the statin drug, you can start to develop things like fatty liver because again, it's just screwing with the way your liver was designed to function, okay? But most importantly, guys, right here, it says Lipitor has not been shown to prevent heart disease or heart attacks. And there's so many people that hear this right now, and when I do it in my talk, people just start to fume. They get so pissed off because they're taking this drug for the last 10, 15, 20, 30 years, and the main reason they're taking this drug is to reduce their risk of heart attack and stroke because that's what their doctor told them it's doing. But yet the company that makes the drug says that it hasn't been proven to do that. And let me explain to you guys real briefly why this is the case, okay? So again, we use the Swiss watch principle. We just talked about this last week. In order to truly normalize function in the body, you have to understand how the body functions as a whole, okay? And so we talked about how these drugs negatively affect the body when you're given them. But most importantly, why do they not even reduce your risk of a darn heart attack if that's what the drugs are given to you in the first place? So let's jump into this real quick, guys. So I love analogies, right? So LDL, bad cholesterol, that's what they tell you. And yes, if the LDL cholesterol is unhealthy cholesterol, and I'll explain to you what I mean by that, but if the cholesterol is unhealthy, the LDLs, that's what's going to be causing the plaquing in the system. And so that's why they call it the bad cholesterol. But if the LDL is big, fluffy, healthy particles, they can't cause any plaquing. There's no such thing as bad anything that the body makes. Your body makes LDLs, how can it be bad? Right, just think about it. The body doesn't do anything wrong. The body doesn't make anything bad, right? It's what happens to those LDLs once they get into your bloodstream. So the typical testing that you're having done, it's your overall cholesterol, your overall HDLs, and your overall LDLs. And so it's kind of like this. Picture this, okay? I've got two scales in front of me. And there's a curtain that's hanging between me and the patients that are on those scales. Both of the scales say 200, but yet I can't see the patients, right? Follow me here. So both of the scales say 200 pounds. Now on one scale, we have a 6'2" male. On the other scale, we've got a 4'8" female. So they're both weigh 200 pounds, but imagine how their composition is completely different. And one could be very healthy weight, and one could be a very unhealthy weight. But yet they both weigh 200 pounds. Follow me so far, right? And so that's what they're doing when they test your cholesterol levels. They're just looking at the overall number. So I'm here to tell you guys, there's no clinical significance to that kind of testing. It tells you absolutely nothing about your risk of a heart attack. I don't care if that number says 150 or says 50, we know nothing about your true risk of a heart attack or stroke. So why aren't they testing you differently? The easy answer is because your insurance companies don't want to pay for advanced testing. That's the main reason. I'll give them the benefit of the doubt. Their hands are tied. The pharmaceutical companies determine what they do, what they don't do, what drugs they use, what testing they use. And so they don't want the advanced testing done because all they want these doctors to do is prescribe you a statin medication. Most popular medication today, okay? So particle sizes are much more important than how many. So again, I love analogies. Here's my analogy, guys. The inside lining of your blood vessels. Okay, there's 3 layers of smooth muscle. The very inside lining, it's like a tennis net. So when those LDLs come out of your liver, they're big and fluffy, they're the size of tennis balls. Tennis ball cannot slip through that tennis net, therefore it is impossible for those to cause any plaquing in your system. Now, with different inflammatory processes, eating foods that you're allergic to, having GI infections, having elevated blood sugars, dealing with a lot of chronic stress in your life, all these things that are causing inflammation in your body, they cause these LDLs to shrink down to dense particles, the size of a golf ball. That golf ball is going to slip through the tennis net, and now we know, beyond a shadow of a doubt, that you're plaquing inside of your arteries. So why aren't your doctors testing that? Again, guys, number one, your insurance won't pay for it. But guys, this is a cheap test. I mean, I can run a test like this for 90 bucks, right? The main reason they're not testing you for this is because a statin medication has zero effect on a big fluffy LDL shrinking down to a small, dense, harmful LDL. A statin drug could not stop that from happening. This is why Lipitor is telling you that there's been no research that proves that a statin medication reduces your risk of a heart attack or stroke. Yet millions and millions and millions of people are taking them. It's increasing your risk of dementia, Alzheimer's, Parkinson's. It's causing fatty liver. It's giving you all kinds of nerve conditions. It's driving neuropathy conditions. I mean, must I go on? These medications are detrimental, and they're not even doing what your doctors have told you that they're good for. It just blows me away. It absolutely blows me away, guys. So, with that being said, you got to test. You got to find out what is going on inside of you. In order to truly find out your risk of a heart attack or stroke, guys, you got to get tested. And it happens all the time. People come in here, they've been on a statin medication. Doc says I'm doing great because my cholesterols are in the normal range, yet they're full of golf balls in their system. They're plaquing like crazy, and they're still at a high risk of a heart attack. Guys, cholesterol is necessary. You've got to get tested properly to find out if you're at a risk or not. If you're taking statin medications, you're not doing the right thing for your body. You've got to find out why your cholesterol is high, fix why it's high, and then we'll see that come down to a normal range. Again, whatever that range is, it's different for everybody. So, guys, share this video around. If you've got any specific questions, drop them in the comments.